So can you just show us how a couple of these devices work and how you might advance them?
Yeah, so there's a lot of different appliances on the market. Most dentists who are experienced in the field are using maybe 3 or 4 different appliances where they're good studies. One is called the dorsal. This is probably one of the main ones we use. So all the appliances have got an upper and a lower, and obviously we make it as thin and small as possible because it's really important that people wear it. You know, we can have great treatments, but if people don't wear it, then it's not going to work, obviously. So they're very thin. Fortunately, with the modern day materials, that we can make them really thin and strong. So it fits over the top jaw like that. You can see it's kept well away from the gums. And then we have a lower one, and they all have a way of holding the jaw forward. So with this particular device here, there's wings on the side which stops the jaw. The jaw wants to be back a bit further, and it just sits in that position there. And then you can put a key. There's a mechanism here, and you just put a key in the side, and you can just bring the jaw forward by just moving a segment here forward on both sides. So just do that very slowly. So people might do that over a month or so. You know.
And how far is each turn if you're moving at one turn?
Yeah, so each turn's only about 0.2 of a millimetre. So we just say go very slowly. We might start with the jaw a little bit forward, and every appliance you see here has all got a different way of holding the jaw forward. This is another appliance that we use called the silencer, and as you can see, it's very, very thin. So you probably can't get a thinner appliance than that. And then the way you bring the jaw forward is that you take these connectors off here, and as you take them off, you put a shorter one on, which brings the jaw forward. So you get an array of those. So every appliance here has just got another way of holding the jaw forward. So and they're all effective. But the reason we make this appliance more than any other one is that it's the only appliance which isn't connected at all. Yep. So the patients can just open and close and talk and sip water and things like that.
And when might you use the silencer type device?
Yeah, so I might use this appliance if the patient's just got mild sleep apnea, and if they've got a very sensitive mouth. A lot of the patients we see have got really small mouths, and that's why they've got sleep apnea. So there's not a lot of room for anything. So we can make this really thin, maybe 1 millimetre thick, 1.5 millimetres. So we might use that in that situation. And if someone's a really strong clencher and grinder, which a lot of people are that have got sleep apnea, then we might use something like this appliance here, which you can see is very robust. It's got some stainless steel arms here, which can allow movement from side to side, and you can still adjust it. So you can bring the jaw forward just by putting sort of a key in there and just turning it, going like that. So yeah, so I think it's important for a dentist to have an array of appliances and just choose an appliance that's appropriate for that person.
Yeah. And with using these type of appliances, are there any problems to look out for or things people should be aware of?
Yeah, so look, most people adapt really well. If you don't start with the jaw that far forward, really people don't have any pain at all, but just the mouth's a sensitive place, so generally they're aware of having something in the mouth for a couple of days, get a bit of extra saliva, maybe for a week or so. But if it goes the way it does for most people, they usually don't have any discomfort at all. So, sometimes people are strong clenchers, and if you go a bit too far forward, sometimes people are keen to get rid of that snoring, so they just crank it forward, you know, against our instructions, and they might get a sore jaw for a day or two, but you can usually overcome that pretty easily.
Great, thanks very much, Harry.
Okay, thanks, David.